Good afternoon, good evening, everybody. A very warm welcome to this press briefing from the WHO European Regional Office here, joining you live from Copenhagen today. Very grateful that you could all join us, particularly to the media colleagues. I appreciate that we've got many questions that have been sent in advance, and I can see that we have many of you joining online as well. Very grateful for that. A warm welcome to you all. So on the panel today, we have the Regional Director, sat here to my left, Dr Hans Kluge. We have the Incident Management Team Lead, Katie Smallwood, and we have our Regional Advisor on Immunisation and Vaccination, Dr Siddhartha Datta. A warm thanks also to them for serving as our panel today. So, a brief reminder. Please raise your hand in the system if you'd like to put a question forward to our panel. And we're very grateful to take as many of those questions as we can in the coming hour. So with that, I'll hand the floor over to the Regional Director to make a few remarks.
Thank you, Rob. Good morning, good afternoon, everyone. Even though we are still seeing more than 1 million cases reported every week across the European region, the overall case incidence of COVID-19 has been declining for 4 consecutive weeks. And for 2 weeks in a row, the number of new deaths has decreased. While this is good news, the decline in cases conceals increasing numbers of outbreaks and community spread involving variants of concern, meaning that we need to watch overall trends in transmission carefully and avoid rash decisions. The numbers we are seeing are still too high. 2 days ago, 40 countries in the European region reported 3,610 deaths in 24 hours caused by COVID-19. At this point, the overwhelming majority of European countries remain vulnerable. Right now, it's a thin line between the hope of a vaccine and a false sense of security. Based on information from 29 out of the 37 countries currently vaccinating in the European region today, 7.8 million people have completed their immunization series. That is equivalent to only 1.5% of the population of those 29 countries. Yesterday, 17 states and territories in the WHO European region had a 14-day incidence larger than 400 reported cases for every 100,000 people. This warrants measured decision-making at this critical juncture. Time and again, have we seen countries reopen too fast and lose hard-earned gains? I must reiterate that decisions to lift public health and social measures need to be underpinned with data based on epidemiological assessment and health system capacity. Criteria need to be evidence-based and not based on observations of relative progress. Many of you worry about new variants, about how infectious they are, whether the disease they cause is more severe, whether vaccines will be less effective against them. Some variants are indeed of particular concern. We have all followed the reports on how receptive the variant B.1.351, first identified in South Africa, is to the Oxford AstraZeneca vaccine. This particular variant of concern has been reported in 19 European countries. Although community transmission in Europe is not yet widespread, the variant has increasingly been linked to outbreaks in communities. Irrespective of the variant, we must continue to suppress the virus. Yesterday, the WHO Strategic Advisory Group of experts on immunization concluded, based on all available evidence, that the Oxford AstraZeneca vaccine can be used in persons aged 18 years and above, including people older than 65 years. What does the emergence of these variants mean? It means that we must do everything in our power to reduce transmission and delay mutations that may influence vaccine efficacy. Unless we halt transmission now, the expected benefits from vaccinations in controlling this pandemic may not be evident. This means that manufacturers will have to adjust to the virus evolution. This also underlines the importance of maintaining a diverse portfolio of vaccines of various technology platforms for use in a range of settings. Vaccines are essential, but as of now, they are not sufficient to control the pandemic. They are only one among many tools at our disposal. What has not changed is how the virus transmits. Temporary setbacks do not change the fact that current responses are having an impact. Despite new variants, WHO's guidance on social and public health measures remains unchanged. And there is some more good news. 35 state parties have extended their genetic sequencing of SARS-CoV-2, as have 18 others supported by WHO's reference laboratories, due to the growing importance of identifying new variants. Based on data from nearly 20 countries, the hospitalization rate due to COVID-19 fell from 13 to 11 per 100,000 people between the 3rd and 4th week of January. A decrease, yes, but many of our hospitals continue to struggle. The number of vaccine doses given has also exceeded the number of reported cases in the region. Some 41 million doses administered versus 36 million reported cases. Vaccination of priority groups is already saving lives. But the sheer scale of COVID-19 vaccine deployment is enormous. Vaccinations will take time. Vaccines offer a way to emerge faster from this pandemic, but only if we ensure that all countries, irrespective of income level, have access to them. The divide between high, middle and low income countries is clearer than ever. Unfair access to vaccines can backfire. The longer the virus lingers, the greater the risk of dangerous mutations. Equitable access is a moral imperative, one that mitigates the pandemic's impact on all of us, not just some. Together with the European Union, today we launch a €40 million program to ensure effective deployment of COVID-19 vaccines in 6 countries: Armenia, Azerbaijan, Belarus, Georgia, Ukraine and the Republic of Moldova. This complements ongoing work through COVAX and the EU sharing mechanism, with an initial focus on readiness, information campaigns, supplies and training of health workers. Yesterday, I also signed an agreement with the European Union to support the countries of the Western Balkans in their efforts. In addition, we have a joint EU-WHO program for the response across the Central Asia region. The time to scale up and accelerate vaccine production is now. We are calling for a joint European effort to get vaccination programs on track. Manufacturers and healthcare providers need to share clinical data and dossiers with WHO so that we can accelerate emergency use listings. We are also identifying smaller production sites with enough capacity and quality criteria in place to help manufacturing of vaccine components. Again, the key here is solidarity and pragmatism through synergizing vaccine production capacity. Finally, a very happy birthday to Sister Andrée, Europe's oldest person, a French nun who celebrates her 117th birthday today. A COVID-19 survivor, there's a remarkable lesson to be learned from Sister Andrée, who, during her illness, selflessly showed more concern for her fellow nursing home residents than for her own life. Look after each other and stay safe. Thank you.
Thank you very much, Regional Director. Right, I will go to the questions. I'll start with some of the questions that we've been sent in advance. Understandably, we have quite a few questions regarding vaccines and vaccination, and I'm going to start there with Miss Janet Ernst, who has sent us a question from the Kabar 24 TV network in Kazakhstan. And I think this one's for you, Siddhartha Datta. There are two questions. I'm going to read them both because I think you can probably tackle both in one response. Several European countries have decided not to give AstraZeneca vaccine to older people. The WHO has begun retrials of this vaccine. What are the reasons behind this? And the second part of the question is, so far, experts have been claiming that all existing vaccines protect against new strains of coronavirus. What vaccine platforms are more convenient for conversion in the event of an increase in the number of COVID-19 mutations? Over to you, Dr. Siddhartha Datta.
Thank you, Rob. Thank you, Janat, for asking that question. So, yes, we have heard about several of our European countries who have made a decision to not use or not give AstraZeneca vaccine to older people. Just wanted to highlight a couple of elements in that decision making. Both the European medicine agencies and other stringent regulatory authorities have given very clear indication on the safety and efficacy of the AstraZeneca vaccine to different age groups that are available from the study of the clinical trials. As we have heard, the regional director also say today that the strategic advisory group of experts have also looked into the available information from the clinical trial regarding the AstraZeneca vaccine. The strategic advisory group of experts have outlined that this vaccine can be used for people above the age of 18 years, including those who are above the age of 65. But the countries which have made this decision are primarily having also a second or multiple vaccines available at their disposal. The Pfizer vaccine, for example. The national technical advisory groups of this country are making a conscious decision on looking into a couple of elements. One, what is the local disease epidemiology that they have in their countries? Number two, what are the vaccine volumes that are available? So these decisions on vaccine implementation across the country to different age groups are based on these two parameters. These countries have a second or a third vaccine at their disposal, which they can use themselves. The question on the WHO has begun a retrial of this vaccine. This is not necessarily true. What WHO is doing is to understand the different vaccine level effectiveness of the AstraZeneca and other in the countries where they are being used, to understand the effectiveness of the field level effectiveness of these vaccine to different age groups. So as more evidence come out from these AstraZeneca vaccine use, the strategic advisory group of experts will again review this information for better or other interim recommendations moving forward. The experts on your second question, which talked about the new strains of the coronavirus vaccine and the different vaccine platforms that are being used, I think this is an unprecedented effort being made by several vaccine developers to use different technology platforms for COVID-19 vaccines, the mRNA, the adenovirus-based vaccines, and others. So I think this will provide an opportune moment to do some tweaking, as we hear from several vaccine developers at this point of time. They have already started to look into what changes need to be done in this technology platform so that the vaccine can be made effective for the new strains of the coronavirus or the new mutations of the coronavirus as we see. More need to be learned about these processes, and I think as we hear better from the different manufacturers and the field level studies that will be conducted, we will be getting to know about the efficacy and again the safety and efficacy of these newer platforms or the newer vaccines that will be in offering. Thank you.
Thanks very much, Siddhartha. And I think in answering Miss Janet Ernst, you've also responded to a question that we received from Hilmar Reimenschneider, from who's the head of the press team at Hospital Society for North Rhine-Westphalia in Germany, which was also related to the use of the AstraZeneca vaccines. But thank you, Hilmar, for your question, which I hope that Siddhartha has just adequately responded to as well. So next, I'm going to go to join our journalists that are joining us online, and over to Oskar Gozinski from the Polish press agency, who joins us live online. Oskar, please, your question.
Hi, can you hear me?
We can. Please go ahead.
Great. So my question is, given that the South African variant of the coronavirus has already been shown to be more resistant to the immune response provoked by vaccines and not just AstraZeneca, is that, and it's already been observed in Europe as Dr. Kluge has mentioned, is it basically inevitable that it will dominate in Europe? And should we be planning for this contingency? And my other question is, could Dr. Kluge talk a bit more about the plan to support the Western Balkans that he mentioned?
Thank you very much indeed, Oskar. Okay, so regarding the dominance of the question regarding dominance of the South African variant, I'm going to pass that over to Katie Smallwood. Katie, can I ask you for a response to that, please?
Yes, you can. I hope you can hear me, and thanks for the question, Oskar. It's a good one, and of course there's several variants of concern that we are tracking very carefully across Europe, and one of these is the variant that was first identified in South Africa. So the lineage for that one is the B1351. As the regional director said, it has been identified in 19 countries. For the time being, most of those are linked to travel, but we have seen some outbreaks, and those outbreaks have been occurring with slightly increasing frequency over time. So we must be concerned about it, aware about it, and we must be taking measures against it. And we would certainly recommend that all countries look at their transmission scenarios, regardless of the variants that are circulating, and take action to reduce transmission. Because every time we identify a new variant, or every time we see increased transmission because of less adherence to the public health and social measures, we always come back to the same basic principle, which is we need to drive transmission down. And driving transmission down will not only mitigate the emergence of those variants of concern themselves, and that's because as much as the virus continues to move between us as humans, and it's been doing so now for over 13 months, it will increase in its likelihood to adapt better to us and to adapt better to transmission and develop mutations that may change the characteristics of the disease. So that's why we need to prevent the mutations from occurring in the first place by reducing transmission. But also when those variants of concern do emerge and when they are picked up by our surveillance systems, we need to reduce transmission to slow their spread. So is it a given that one variant will outcompete the others? Maybe over time. We don't know which of the variants that are currently spreading in the European region and in the wider world will be more competitive. But our strategy needs to be blind to the variant themselves and focus on suppressing the virus and all those variants. Thank you.
Thank you, Katie, and thank you, Oskar. You also had a second question related to the Western Balkans for our regional director.
Thank you, Oskar. So indeed, this builds upon a long-standing collaboration with the Western Balkans, because one issue is access to the vaccine itself. The other is what we call the vaccination part. So A to Z, meaning that if and when the vaccine is available, that the health system is prepared. And this goes from working together with the national authorities on the regulatory procedures to ensuring that there is a system in place of monitoring the safety, the procurement mechanisms. That's one part. The other part is what I would call vaccine diplomacy, that we are assisting the governments in anticipation when the COVAX will become fully operational, seeing that the possibilities of, for example, donations from neighboring countries to kickstart already the process with priority on the healthcare workers and the elder people. Thank you.
Thank you, Regional Director. Next, I'm going to go to Ms. Ketavan Kadava. I can see, Ketavan, that you've sent us a question in advance, but I can also see that you're raising your hand and are with us here. So I will put the question to you.
Hello, can you hear me?
Please go ahead.
Thank you very much. I have a question about Georgia. You have just made a statement about financial support for our region and want to know more about it, how this money should be spent. This month we're waiting for Pfizer vaccine. Hopefully that it will be this month. We are talking on this stage about approximately about 29,000 doses. Of course, this is not enough for all. So your recommendation, assessment of the situation, and what is next for our region, especially for Georgia. And of course, and also I want to ask you about recommendations as from Monday, classes will resume at school and the restaurants will start operations. So it's very, very important for us to listen to your assessment. Thank you so much.
There are many questions in there, so I'm actually going to go to all three of our panelists, starting with the Regional Director. And then I appreciate that you've asked a question there, Ketavan, on the financial support and support to Georgia, but also on assessing the situation. So I'll go Siddhartha and then to Katie after the Regional Director.
Right, thank you, Ketavan, for the multitude of the questions. Just before Christmas in December, we went on a mission which I headed to Tbilisi, and it was in fact in the middle of the lockdown, to further discuss, agree to scale up our collaboration on COVID-19, but also on other very important health matters like universal health coverage with the government, and particularly with the Minister of Health, Dr. Tekaradze, for which I'm very appreciative. And the support builds on really strengthening both the control and the preparedness of the health system, including also the capacity strengthening of the healthcare workers. And as my colleagues will continue to tell, indeed, we also had discussions on the small-scale first batch of the Pfizer-BioNTech vaccine, which is now being accelerated in anticipation of a further acceleration and expansion of the vaccination program.
So, Siddhartha, can I ask you to just comment on the support to Georgia for readiness in terms of the vaccination program?
Yeah, thank you so much, Rob. Thank you, Ketavan, for asking that question. So just to elaborate, yes, as you have mentioned, Georgia will be one of the first 4 countries in the WHO European region to deploy a limited number of Pfizer-BioNTech vaccine procured through the COVAX facility in the next few weeks. We are waiting to hear the dates as you are, anxiously waiting. But I think it's extremely important that we do understand that there are several elements that need to be put in place in a country before the vaccine can reach and start being rolled out. Within this process, what WHO's had a 2-step, at least at this point, until at this point of time. One was preparing the country to receive it. That means all the processes related to regulatory, related to vaccine supply management, related to vaccine safety monitoring, and also data management. These are the critical elements, as we felt, that was outlined by the independent experts of immunization in the region as well. So that was the preparedness phase. As we now know that from the COVAX facility letter, that they will be receiving Pfizer-BioNTech vaccine, which has got its own vaccine characteristics. Plus, also we know the volume of vaccine which is coming. WHO Europe, starting today, as we speak, are doing readiness check and fix with our ministries of health. This is an extremely important element. We want to see that at this point of time, WHO has convened this meeting with Georgia. This will be today afternoon, starting at 12 o'clock Copenhagen time. We will be engaging with the different agencies and the ministries of health to understand their readiness level. And this is involving readiness to receive, to deliver, to administer, and to monitor the vaccine efficiently and safely. These all are extremely important elements in a vaccination step, which you have heard Dr. Kluge say in his inaugural address. And I think this is a process that we ascribe great importance to, because having a vaccine coming and landing in an airport is one part of it, but making sure that when the vaccine is there, it reaches to this beneficiary for whom it is intended to. So this preparedness and readiness now is an extremely critical element in the vaccination rollout in Georgia and also thereafter in other countries. Thank you.
Thank you very much, Siddhartha. And Katie, on the situation assessment on Georgia, briefly, please.
Very briefly, Ketavan, three remarks for Georgia and for any other country that has managed in the past month or so to really bring down transmission rates, bring down hospitalizations, and bring down deaths due to COVID-19. First of all, do not drop your guard, as the regional director says. Take stock of where you are. Be cautious in taking measures that lift the restrictions that have been very effective in bringing down those cases, but also, of course, that have secondary consequences on society. Second point is understand what can be improved and improve the quality of your interventions now that cases are back down to manageable levels. Really focus on those, as well as the vaccination rollout appearing on the horizon. You will still need to intervene through all of the tools that we have at our disposal for a significant period of time. And third, set very clear criteria for when you might need to reintroduce some of those measures, and make those criteria as early as possible so that you can lift them as early as possible and control any increase in spread as quickly as possible by preserving the interventions that you have, and by basically that will lead you to be able to preserve the economy, preserve the society, whilst saving lives and preventing infections. Thank you very much.
Thank you very much, Katie, and thank you, Ketavan, for your questions. So I'm next going to go to a question from John Goranitis from Inside Story in Greece. This is for the regional director, directed to the regional director. Most European countries have been shutting down and reopening over and over without a clear exit strategy. In this context, quite a few experts are asking for a zero COVID strategy in order to eliminate the virus before opening up their economies, societies and borders. Do you agree with them, given that all countries that defeated the pandemic have implemented a zero COVID strategy? Regional Director.
Thanks, John. So elimination is something that we want in principle for any disease, for any pathogen, and it can be a very powerful, what I would call, working incentive. But whether we are at the stage now to put targets for a zero COVID strategy is still a different ballgame. What we need to do first and foremost is see how the behavior of the people adhering, to which extent they adhere to the non-pharmaceutical interventions, add up with the timing of political decisions, with the vaccination rollout, and how it will bring the pandemic under control. Also, you mentioned a number of other countries, and we definitely have to continuously exchange experiences, but some of those countries are a bit more, I would say, easier to, let's say, restrict or isolate from international travel. So I wouldn't make any direct comparisons here, but where you do have a point is that there is a need for a longer term strategy to get out of the pandemic, and that's something that we are going to accelerate in the weeks to come, because this continuous opening, closing, while we have a staggering vaccine production, is something that has to be rethought. So you have a very good point there.
Thank you very much, John, for the question, and to the Regional Director for that response. I'm going to go to the journalists online now, and Gunilla von Hol. Warm welcome back, Gunilla, from Svenska Dagbladet in Sweden. Gunilla, please go ahead.
Yes, can you hear me?
Yes, we can, please.
Good, excellent. Look, I have a question on the ski holidays coming up in Europe, among countries, Sweden, of course. What advice do you have to skiers and to ski resorts to have corona-safe holidays and to avoid creating or even boosting the third wave of the virus? And specifically when it comes to the importance of closing restaurants and bars, like Switzerland has done, where people can meet in order to minimize the transmission. Thank you.
Thank you very much, Gunilla. And I'm going to pass that question over to Katie Smallwood to respond to, please. Katie.
Thanks, Gunilla. Actually, I would refer you to the statement that we released just before Christmas, which addresses some of those questions that you raise. And in it, we highlight several things. One, that skiing by default isn't necessarily a high-risk activity for COVID-19. What is high risk is environments where people gather together in groups and associated with travel, and where they may spend high sort of intensity or crowded interactions together over periods of time, mixing and then going and traveling back to their home locations. Those do represent significant increases in risks. And so our advice to local authorities, to governments, but also to individuals is to take decisions based on understanding those high levels of risk that may come from busy ski resorts or busy mountain resorts or busy city centres. So it's not really skiing by default, it's really all of those factors that drive transmission that we need to make sure are not established and not made possible. And that's how we need to decongest travel. We need to avoid people traveling for long periods of times in coaches to ski resorts. We need to avoid people coming from all sorts of different areas and congregating together, socializing together in confined settings without ventilation, without physical distancing in place. So it's really a matter that needs to be addressed at all levels. Thank you.
Great. Thank you very much indeed, Katie, and thank you, Gunilla, for the question. I'll next go to Jamie Keaton, Associated Press. Jamie, welcome back.
Thank you. Thank you very much, Rob. Nice to see you all. The question is for Dr. Kluge. I was struck by your comments about the program with the European Union and the $40 million program, €40 million program. Could you just tell me a little bit about the process of emergency use listing? Are you happy with the information that manufacturers have provided so far? And which countries do you expect in your region will be the first to get vaccines once the AstraZeneca is approved? Thanks so much.
Thank you. Regional Director.
Yes, Jamie. So the principle of WHO is that we work in what we call vaccine agnostic environment. So independent of the vaccine, it is our mandate and duty to work with the countries, what Siddhartha was mentioning, to get the countries prepared and ready and have the check and fix in place so that when and if the vaccine arrives, that the system is ready. Because now what we're facing, Jamie, is indeed a bit of I think we can call it some tension between the international solidarity and the national responsibility for politicians to take care of their own people first. But I'm quite confident that this staggering and temporary delay in getting vaccines to the countries will be compensated by more products and also by beefing up manufacturing capacity, for which I have launched an appeal last week, and I appeal again for an unprecedented public-private mix effort to really have the companies working together to beef up the capacity. And then on the AstraZeneca, what I can tell is that countries who are, I'm not speaking obviously about bilateral deals because every country is free to make those, but that This will become available through the COVAX facility a couple of weeks later than the first batch, the first wave, small batch of the Pfizer-BioNTech once emergency use listed.
Thank you very much, Regional Director. Siddhartha, would you like to expand on or unpack on the 40 million programme in the 6 member states that the Regional Director referred to in his opening statement and say a bit more about that?
Thank you, Rob. Yeah, sure. So, Jamie, thanks for that. So, let me unpack the EU-WHO joint action proposal, which the Regional Director mentioned. The entire proposal is covering 3 different major pillar areas. One is preparing the countries on each of the 10 strategic programmatic areas which was outlined as the critical elements that each and every country need to be prepared for. However, this is also very much intricately linked with preparedness checks, so preparedness and readiness checks. So that is one principal element, because you have heard that these are extremely important elements beyond the vaccine access. The second part is deployment, supporting the countries to deploy the vaccine, to make sure that the plans are in place, the resources are in place, the healthcare workers are trained, the vaccine safety monitoring happens, and obviously data management, which forms a bigger part of it. But however, the third and most critical important element is making sure that any investment done in COVID-19 vaccine and vaccination should have a big implication on strengthening the routine immunization program in all of these countries, with specific emphasis on vaccine demand and acceptance, ensuring the data management happens. So those are extremely important and 3 big pillars, as we are telling within this joint action. So that has got short-term and also a medium and a longer-term implication of this, in generous investment from the European Union. Thank you, Rob.
Thanks very much, Siddhartha. And Jamie will be releasing a news item on this significant support package in the coming 12 hours, so please stay tuned. We will next go over to Natalia Segura from the Catalan news agency. Natalia, welcome.
Hello, good morning. I wanted to ask a couple of questions. The first is, you mentioned that European countries should avoid rushing decisions like lifting restrictions. So I wanted to know what are the risks of lifting restrictions too early, and if this could pose any risk for the vaccination campaign. And secondly, I wanted to ask you on what you mentioned of the need of a long-term strategy to get out of the pandemic, to avoid this opening and closing. I wanted to ask you if you could elaborate a little bit more on what should be this strategy and which options governments may have to avoid this constant opening and reopening. Thanks.
Thank you very much, Natalia. I'm going to pass both of those questions over to Dr. Katie Smallwood. Katie, please.
Thanks, Natalia, and I think the question is quite relevant to Spain and Catalonia, that are seeing decreasing trends at the moment, and they're thinking about how best to start to loosen some of the restrictions that had to be put in place after Christmas, following a significant rise in cases. I think the risks of opening too soon have been made clear in several countries and actually across Europe after the summer holidays. When we saw a relaxation of measures, we saw quick movement back into business as usual, and some false sense of security. And that was quickly corrected by a very significant resurgence of cases in the autumn that presented several very big challenges to many countries. This virus will take advantage of any chance we give it to rapidly spread, and it will spread much more rapidly than we think. The curve will go up very steeply, and it'll come down pretty much slowly. And every time we lift a restriction, every time we open a part of our society, it will shift the balance towards the virus in terms of favor. So these measures, we do know, need to come up very carefully, in a considered manner, based on very clear and objective epidemiologic criteria. Relative decrease does not mean transmission rates are low. In Spain, we've seen a very significant relative decrease, but transmission rates remain very, very high. And you know, the more the virus is among us, the quicker it's going to get a step ahead of us. So in that sense, we really do need to be careful. Bringing transmission rates down will give a much better chance to vaccination. And that's not to say that we shouldn't roll out our vaccination when transmission rates are high. These things do need to go together, and there should be no holding back on vaccination until rates are at a certain level. These need to go out together. They will help each other, but we need to continue with this comprehensive approach with vaccination as a new tool that we hope will be very effective. And we hope, and we don't know, but we hope that this is what will enable us to get into a position of not moving between an extreme of low transmission and then a peak, and then low transmission and then a peak. But at the moment, we really need to bring down deaths. We really need to bring transmission down. And then we need to figure out the way that vaccination and all of the other measures will enable us to reopen societies to the extent possible, and keep transmission rates low, and then move into kind of the idea of how do we bring COVID-19 work into our standard programming? How do we make use of the innovations, and there have been many, that have taken place within our emergency response systems, and bring them back into our preparedness and response frameworks at the national level? And we can start to rebuild these health systems, rebuild our approach to emergency response, with COVID-19 being addressed in a much more programmatic way. And that should be the way forward. But that's still a way off, I'm afraid.
Thank you very much. Next, over to Peter Kenny. Peter, can you hear us? Peter?
Kluge,
please.
Do you hear me okay?
Yeah, please go ahead. Thanks.
Yeah, Dr. Kluge, in his opening address, mentioned a very low rate of vaccination overall in Europe. Yesterday, some journalists in Switzerland heard that about the degree of acceptance of vaccination in Switzerland from last year to a state of hesitancy. There is people queuing up for vaccinations now. Do you have an overall assessment for the acceptance of vaccinations? I know we have people who are hesitant, but we also have anti-vaxxers who are ideologically opposed. What is the situation overall for Europe? Thank you.
Thank you very much indeed, Peter, Regional Director.
What we've seen in general, Peter, is that indeed the vaccine hesitancy, which first and foremost is nothing new. We have seen this, right, whether it was with measles or other vaccination campaigns, but was particularly an issue when there is a shortage of vaccines, because people legitimately ask themselves questions about the speed of the development of a vaccine, which is historically unprecedented, and also about safety concerns. But when and if the vaccine becomes available in larger portions, that the hesitancy seems to drop. That's one point. And a second point, which I also exchanged exactly on this issue yesterday with Dr. Anthony Fauci, the chief medical advisor to the US president, and exchanging playbooks, was that it's so important to have the healthcare workers with us. Right? We want the healthcare workers to lead by example. And it's so important that they themselves are vaccinated, as they're really the unsung heroes in this fight. But we should also remember, this is not routine immunization. This is really pandemic immunization. A bit more on the details, I think that we can ask Siddhartha probably, Rob.
Absolutely. Please, Siddhartha.
Thank you. Thank you so much, Peter. And continuing from where Dr. Kluge mentioned, I think thank you, Dr. Kluge, for mentioning two important elements that we all need to remember. That when a person or persons, they all ask us questions, about the safety, efficacy, and the different research and development around the new vaccine, we all should see this as an health-seeking behavior of the population. They want to learn more because they are going to make an informed choice. And I think within this concept, we have to appreciate people being curious to know about a product. And this within this health-seeking behavior comes what Dr. Kluge mentioned, empowering our healthcare workers, health professionals with all adequate information which they can reply to when a person comes and ask this question. This will be extremely important moving forward when all countries will start deploying the vaccine. You talked about what are we learning about this acceptance of people's behavior. Within the regional office, as a flagship program of the regional director, the behavioral insights team here in the regional office is making surveys in different countries to understand people's perception about this vaccine. We are also seeing a positive influence of people's behavior towards the perception or acceptance of the vaccine, which is very encouraging. We have seen such trends also in the routine immunization program. And then the most important element, which is also coming up in this survey, who is the most trusted person in the society where a person would go to seek information? At this point of time, as also had been in the past, they are our healthcare professionals. So that is where the entire focus should lie on. Then just one comment on what you said about the low rate of vaccination. The 41 million plus doses which have been provided in the European region until date is an enormous undertaking. The effort being made by the immunization system, the health system to deliver these doses to people and the beneficiaries, they are obviously the people who are with comorbidities and people who are above 65, is an enormous undertaking when the health system itself at this point of time is still doing COVID-19 response. So I think we have to acknowledge this effort in this and the undertaking by the Ministries of Health. Thank you.
Thanks very much. So Kostas and Stefano, I can see you've got your hands raised in the system, but before I come over to the both of you, I'm going to ask a question that was sent to us in advance from Alessandro Cosu of the Igor Agency in Italy. There are two components to this. I'm going to put both forward and then ask the regional director and Siddhartha to respond. So questions. Given that high-income countries have a high demand and spending power for COVID vaccines and have provided so far a low contribution to COVAX, do you think that third-party manufacturers have become a key option to expand production capacity and make vaccines accessible to everyone and speed up the immunization of the global population? The second part of the question from Alessandro, does WHO supports the idea proposed by India and South Africa that would grant compulsory licensing of COVID vaccines and drugs by overriding patent rules of WTO's trade-related aspects of intellectual property (TRIPS) agreement, allowing generic or other manufacturers to make the new products. What do you think of the fact that high-income countries opposed this proposal? So I'm going to go to the regional director, and then I'll go to Siddhartha Datta.
Dear Alessandro, last week we called for a pan-European joint effort to get the vaccination programs on track, and we definitely need more and fast more products on the list. So, as I was mentioning in the statement, it's so important that manufacturers and healthcare providers share the full dossier, including the clinical data, with us for the include more products into the WHO emergency use listing. Also for us to identify smaller production sites with enough capacity and quality criteria in place to help in the manufacturing of vaccination components and packaging. So what we call for, in fact, is an unprecedented solidarity among producers to kind of synergize their efforts in a pan-European effort of vaccination production. So we're talking basically about a massive public-private mix, which is more urgent than ever.
Siddhartha, can I ask you to add? Thank you.
Thank you so much, and thanks, Alessandro, for that question. The COVAX facility, as we all know, is an unprecedented collaboration between Gavi, WHO, CEPI, and with the manufacturers. At this point of time, as we speak, 190 participating economies are part of it, of which around 98, 99 are higher income economies. So we just also want to acknowledge the generous contribution and the pledges of the European Union through the Team Europe, Norway, Denmark, Estonia, Netherlands, amongst other countries. I think they have played a great role into ensuring that the COVAX facility and the research and development associated with it of the vaccines are beefed up. The latest projection from the COVAX facility, as we are aware of, that almost 2.3 billion doses of COVID-19 vaccines will be rolled out worldwide through the COVAX facility during this year. And actually this reaches almost around 27% of the population of the lower income countries across the globe in 2021, much higher than the 20% target that it set at its inception. But however, as we speak of these numbers, we need to also keep in mind the uncertainties around capacities, around the funding, around the country readiness, and obviously the vaccine production issues. These are very early teething problems with the vaccine production that we have noticed, but we also still need to remember, as we have heard our regional director said earlier, there are several other candidate vaccines which are still in development. Few of them are sharing their interim results on safety and efficacy, and obviously the issues around manufacturing will also play a big role in the full-scale production, which may obviously influence the volume. So I think this every economy coming together, the high income, middle income, and lower income, demonstrates the global principle of solidarity around which the COVAX facility came into inception. Thank you.
Thank you very much, Siddhartha, and thanks to the Regional Director. So next I will go to Kostas Davanis from ERT Hellenic Public Television. Kostas.
Hello, can you hear me?
We can, Kostas. Please go ahead.
Thank you for taking my question. It's a question for Dr. Kluge. You want countries not to open fast. Are there countries in Europe that, in your view, have already opened up very quickly? Is there not a common way to assess the risk management of the coronavirus pandemic? And my second question, it seems that the spread of the South African mutation is not directly related to travelers, but to communities. So the fire that has broken out in 19 countries in Europe can spread everywhere quickly. How can we limit it? Thank you very much.
Thanks, Kostas. I'm going to go to the Regional Director and then over to Katie Smallwood.
Thank you, Kostas. On the first question, we have seen this since the very start of the pandemic. And remember, this has been our advice whether to go to restriction and lockdown or whether to reopening, that it has to be done gradually and safely. These are the two key words. So we have seen this, yes, definitely in across the region. Different examples, that there was too fast lockdown and crushing the virus, but also pushing people into the poverty or into mental health issues. I'm extremely concerned about the parallel pandemic of mental health, not at least in adolescents and young people. And we are currently measuring the impact of COVID-19 on mental health. And this is in Europe, but Dr. Fauci was telling yesterday is the same in the United States. The social effects of children not being able to go to schools, especially primary schools. So we know what to be done. The same for the second part of the question before we go to Katie, right? That still I guess the biggest mistake we could make is to lower the guard because the vaccines are getting rolled out. You saw from my press statement that only about 1.5% in the countries which are reporting on vaccination are being vaccinated. So basically we need three things. First is to speed up the vaccination. This is a priority, public-private mix. The second one is the 3 W's from wash your hands, watch your distance, and wear the masks, and try to limit indoor contacts. And the third one is still a lot of work to do on strengthening the health system to increase the testing, isolation, contact tracing, and quarantining. Thank you.
Thank you. Katie?
Thank you very much, Kostas. And I'll say a little bit on the variant of concern again. So just to reiterate that the B1351 variant of concern that was initially identified in South Africa has been picked up in 19 countries as of yesterday in the European region, but still most of those countries are reporting that variant in the context of links to international travel. However, there have been, in some cases, some increasing reports of community transmission outbreaks linked to that particular variant of concern. So we need to bring down transmission to avoid them from spreading. More specific to the European Union and to the broader European region is the ongoing spread of another variant of concern, so-called the lineage B117, that was first identified in the United Kingdom. That is now very clearly circulating in the communities in more than half of the countries around the region, or close to half the countries around the European region. And that particular variant of concern, especially in Western European countries, is spreading in terms of prevalence more quickly than other lineages. And so it's really important that we keep an eye on the overall transmission rates, because very quickly, once it becomes dominant, it may impact the epidemic curve overall and may lead to the need for a more restrictive approach to the public health and social measures that need to be placed so that the transmission, overall rates of transmission can decrease. So when it comes to opening or lifting some of those measures at the moment, WHO is not saying that countries are doing so rashly right now, but based on the epidemic trends in the countries in the region, we are seeing relative declining trends, which is a good thing. But we're warning countries not to act too fast, especially in the context of variants of concern, and especially in the context of the gradual rollout of vaccinations. And all of these things need to be very cautiously looked at based on the data that we have on the epidemiology, on the health system capacity, and on the circulating variants of concern. Thank you.
Thank you very much. And last but not least, Stefano Valentino. We have one more hand raised from the European Data Journalism Network. Stefano, please go ahead.
Yeah, thank you. I'm always the last but not least in the conference. Thanks for taking my question. So I have actually a couple of questions. I know that the WHO already approved the Pfizer-BioNTech vaccine to be rolled out across the world. But as you know, this vaccine has a very difficult logistics, mostly due to the cold chain requirements. So I guess it will be quite difficult to deploy it in low-income countries, also in tropical countries where the weather is very hot. So I was wondering why, or whether the WHO will not consider to approve and to recommend more established and traditional vaccines like the virus inactivated or subunit vaccines produced in China and India, which could be actually more easily produced also in countries which don't have high know-how and technologies. And second question, given the fact that there is no evidence that vaccines approved so far in Europe, US, actually prevent also transmission of virus. But so far the evidence is only that they block the disease, but not the infection. I was wondering if that will not jeopardize the effectiveness of the immunization campaigns, and also the fact that the virus is still transmissible will not also hamper the the fight against the variants, because even though you immunize lots of people, but then people can still transmit the variants to others, then basically you need to go back to the starting point.
Thank you very much, Stefano. I'm going to go over to Siddhartha. Siddhartha, you got that Pfizer cold chain related question, and the second one, and approval of other vaccines, and the second one relates to vaccine effectiveness against more transmissible variants. Please.
Thank you, Stefano, for those questions. Very, very valid ones. So let me take the first one, which is Pfizer-BioNTech vaccine. Yes, I think we are aware of the vaccine characteristic that's needed. And that is why you have heard about two important elements that we talked about. One is preparedness level, and the other one is readiness check. This is what is extremely critical for any vaccines that is being used in the vaccination program. The vaccination programs in the countries, the normal routine immunization programs are designed to use vaccines which are -20, used for oral polio vaccines usually, and the other vaccines which are at 2 to 8 degrees centigrade. And that is the reason why within the COVAX facility, together with WHO and Gavi, we are checking with the countries to see whether they do have adequate cold chain capacities and cold chain characteristics to accommodate the Pfizer vaccine. In terms of the other vaccines and the emergency use listing by WHO, WHO is working with all the vaccine manufacturers to submit the dossiers and the important documents on the clinical trials. It is irrespective of the country of origin of that vaccine or the developers who are working in those countries. The rigorous process, the scientific process that goes on for evaluation of all the vaccines are exactly the same for all the vaccines. The country, there are available information in the WHO website for public knowledge which vaccines are in the pipeline for receiving the emergency use listing. And this is being updated every second week. In terms of the transmission of virus and its effect on the COVID-19 pandemic, the vaccines in its current form are designed to reduce severe mortality and deaths. However, there are concurrent processes and trials are ongoing to understand whether there is any effect of these vaccine on the transmission. As you have heard from both Dr. Kluge and Dr. Smallwood earlier, we don't think that we should wait for a perfect vaccine to come, which will cover everything, and then start using a vaccine. We have to use all available tools that we have on our hand so that we can contain the pandemic in its current form. Even reducing diseases or preventing deaths by giving these vaccines is a big contribution to this entire pandemic. And vaccines, as we all learn now more from different manufacturers and developers, will continue to be reviewed by WHO, and we'll keep an eye of how newer vaccine technologies, newer vaccine properties come through. So I think it's an wholesome, it's not only one and all, it's not a cherry picking one over the other, it's a wholesome effort to contain the pandemic. Thank you.
Rob, could I add a comment?
Please.
Very quickly. I just want to add that we have several countries in our region that have the B117 lineage in dominant form transmitting, but who are also early starters in the vaccination rollout. And these countries are gathering information based on observational studies and also looking at their epidemiologic information for COVID-19. And there's no indication whatsoever to suggest that any vaccine rollout is not effective for the B117 variant. And so it must be very clear that we should not be looking at variants in terms of taking decisions on vaccination at the moment. We need to move ahead. Thank you.
Thanks very much, Katie. Thank you, Siddhartha. Thank you to the Regional Director. Thank you to the media that have joined us today and the public. We'll be next with you in 2 weeks' time on Thursday, the 25th. Please do keep an eye, however, on our media pages for statements that will be published, I'm sure, over the next fortnight on different topics. In the meantime, it only remains for me to say, look out for each other, please, and stay very well and very healthy.